single one of us. The president making a big push to extend coverage to the millions of uninsured. But it comes with a hefty price tag, and some fear it could also reduce the quality of care for the rest of us. So as Congress looks into the president's plan, some GOP lawmakers have come up with a plan of their own. One of them joins us now. He is North Carolina Senator Richard Burr. Senator, thank you, sir. One of the plans, and I want to put this up on the screen for our viewers, is kind of resurrecting something John McCain touted on the campaign trail. MediChoice. It's a tax rebate that will give individuals $2,200. McCain wanted to give them $2,000, and families $5,700 to spend on health insurance. Why would this be better than a national health care plan?
Well, Trace, obviously this plan would bring down the overall cost of health care and make health care affordable for every American. I believe that we also need to transform the healthcare system from one that triggers when we get sick to one that actually invests in prevention and wellness and disease management. And this plan accomplishes that. The president's plan spends $1 trillion to cover 16 million Americans. That leaves a lot of Americans without coverage.
You know, Senator, on the campaign trail, then Senator Obama highly criticized John McCain for talking about the tax cut right there, the tax give back, $2,200, $5,700. But what he didn't say is that now we're talking about his criticism of McCain back then was the fact that he was going to tax your health benefits, saying John McCain, well, now we may get a public policy and our health benefits taxed.
Well, Trace, I believe it's time for us to equalize the tax application of health care in this country, and you can do it one of two ways. You can provide deductibility, which leaves a lot of Americans that don't pay taxes out, or you can have refundable credits. And this plan devised by Dr. Coburn and I has no net tax increase to the American people because it provides every family the same credit to pay the taxes or to access the health care at the end of the day. We transition health care, though, to a system that really does promote prevention, wellness, and disease management. And those are the three things that we have to get a handle on if we want to drive costs down.
What if this public plan goes through? How are we going to pay for it, Senator? I mean, has anybody figured out, because we haven't got an answer, we've been asking now for weeks and weeks, anybody figure out beyond taxing health benefits how we're going to pay for this thing?
Well, Trace, with every dollar we spend today in Washington, we borrow 46 cents of it. For the president's health care plan, we would do exactly the same thing. It would probably be higher than 46 cents, though. So the American people should be worried about this insatiable urge to spend and not worry about how it affects the next generation.
North Carolina Senator Richard Burr, thank you, sir.
Thank you, Trace.